Okay.
Hi.
Hi. After a technical difficulty there, we are now live.
Awesome.
Apologies to everyone who's watching. Hopefully we got this all sorted out on the back end here and we're good to go. So I'm here with Dr. Courtney Howard. Now, Courtney, I'm not sure, do you want me to call you Doc or Courtney or Doctor or Dr. Howard?
Both. I appreciate starting with it just because of all the evidence that says that women are systematically not referred to by doctor as compared to men. So I appreciate starting out like that. And then, yeah, like at conferences, they've audited introductions and the women get introduced as, Courtney, and the men get introduced as Dr. So-and-so. And so I just try to establish norms and then it's fine.
Well, that's foolish.
It's just the way it is, but let's change it.
Oh. Just gonna pause for a quick second here. We're just having another issue right now.
Yeah, no worries. I might take my glasses off. That's probably a little less clear.
Okay. Problem solved. Sorry about that, everybody. Okay, so our lovely Dr. Courtney Howard here is a medical doctor, and I'm not going to get too deep into your introduction. I'm going to let you introduce yourself because I'm sure you would do a much better job of it than I am. I'm not running for leadership.
Awesome. Well, thanks so much for having me. I really, it's always great to chat with different people. I'm Dr. Courtney Howard. I'm an emerg doc here in Yellowknife's Dene territory in the Northwest Territories. So we serve, basically I work at the home of the most northerly CT scanner in the middle part of Canada. So we serve people all the way up past the Arctic Circle. So if you bonk your head in Inuvik, you come see me. And that's why I got so interested in climate change. Inuvik and the Mackenzie River Delta area is actually the most rapidly warming one of the most rapidly warming places on Earth. An 80-year-old elder from that part of the world is living in a place that's 3 degrees Celsius warmer than when they were born. And so I happened to do my initial reading on climate change up there and did a literature review and found out that climate change was the biggest health threat of the 21st century, according to The Lancet. And that was about 10 years ago now, right after I graduated. And I was a bit astonished because I hadn't learned about that at medical school. And so asking around, people say, yes, the ice is forming later. It's more dangerous to walk on. Hunters are more likely to go through. There's consequences for food security, for trauma, for emotional health. And because of that, one of the mandates for physicians is you're supposed to advocate on behalf of your patient population. So, given that I live here, I've really, with the help of the Northwest Territories Medical Association team, spent a lot of time bringing this issue to the attention at the Canadian Medical Association General Council. So we passed resolutions on fracking and the local health impacts of resource extraction and coal phase out and the need to divestment and carbon pricing, all sorts of things, and have also become the president of the Canadian Association of Physicians for the Environment. So I've been involved with them for also about a decade. I've been their president for the last 3 years. So have helped set up chapters across the country to help people, attend to local health issues at the same time as maintaining a national brand. And because I kind of got in at the ground floor of the whole movement, ended up working internationally for the Lancet Countdown on Health and Climate Change as their policy director, as well as I'm taking leave of absence from a role at the WHO as the head of advocacy for their civil society working group on climate change. So essentially I've been focusing a lot of work internationally and on mentorship because I kind of have been at this longer than almost anybody else. And then the pandemic happened. And I thought to myself, you know what? I am pretty worried that climate is going to get sidelined by the pandemic. And we know from evidence that climate change, if we present it in terms of health, it's the best way to motivate populations across the political spectrum to action. Because, when we talk about asthma from wildfires, that is a lot more of something people can picture than, CO2 on a graph. And so especially given that we're in a health emergency right now, which is the result of, an interaction between humans and animals. A zoonotic virus has led to, huge economic problems, a health emergency. So if we consider both climate change and the coronavirus pandemic through the lens of health, really the coronavirus pandemic ends up being the biggest reason we've ever had to take action on climate change as opposed to a competing priority. And so it was with that knowledge and, the incredible, instability of this moment in time and the knowledge that really this is probably the best chance we're ever going to get to redirect the ship given the generationally significant quantities of funds that we know we're going to be spending regardless, that I decided to enter the leadership race. So it's been really interesting being with Greens from coast to coast, and I'm excited to hear your questions from the West.
Awesome. Well, that's a great reason to get into it. Every one of the leadership candidates has had a really, really solid set of reasons. Just before we get to a bunch of these questions here, I had one that just popped into my head here. So you're saying this pandemic is zoonotic virus. It's caused by interactions with animals and people. Would you recommend, like, have some idea about some inkling of reducing interactions between animals and people, some way to make that happen? Or
well, we know that climate change and biodiversity loss are both real drivers of new interactions between humans and animals. So certainly the World Health Organization experts on One Health, which is really the intersection of human and animal health, tell us that we need to really steward our natural spaces to give animals a place to live so that they're not driven into human settlements. And we also need to reduce climate change. When you speak with the elders here, I was actually recently in the Dainville region of the Northwest Territories, and the Grand Chief was telling me that, her brother, who was a hunter, was seeing moose in completely different places than the moose usually were. And, we know that anytime there's, humans and animals are in new proximity, there's the chance for new diseases. And certainly
right.
pandemics often start as a result of a pathogen, a disease that moves from animals into humans. So, really environmental related drivers are likely some of the most likely things to lead us back to another pandemic related crisis. And in terms of other health crises, we know that climate change and other environmental issues basically top the list of the World Economic Forum's prediction for crises, also of climate and health related crises. So this is really a priority for action for me as the physician.
All right. Okay. Solid set of recommendations there. Okay, so first question we've got here is about the Canadian, I always get this wrong, Canadian Emergency Response Benefit, I believe.
Okay, yeah.
The CERB. Yeah, so the CERB has been a critical emergency measure to help Canadians weather the COVID-19 pandemic, but some people say it has become a disincentive to low-income Canadians going back to work. How do you see guaranteed livable income being different? How would you, so this is multi-part, how would you implement a guaranteed livable income in order to ensure that it does not disincentivize work? And what do you see as the main benefits of a GLI?
So the work that's been done on that in Canada, the MinCom experiment that came out of the work in Dauphin, Manitoba, or the Southern Ontario income experiment, both showed that it improved health to a tremendous degree. So the MinCom experiment showed an 8.5% decrease in hospitalization, decreased visits to primary care providers, improved mental health, decreased physical trauma. People stayed in school longer in that experiment. And also in the Southern Ontario, the survey data we have from that, people did the same. And so in fact, what they showed in the Southern Ontario data was that people actually used that opportunity to get more training and to be able to lift their eyes up from the sort of treadmill of short-term, sort of low-meaning, low-wage jobs.
Paycheck to paycheck.
To survey the landscape, to get themselves the training they needed to be able to then, spend the time applying for, because applying for a good job can actually take quite a long time, as anyone who's tried to do that knows, right? And so instead of jumping on the next thing, they were able to, properly get their bearings and apply for something that's meaningful to them with a higher salary, and did better. And so, one of the best ways to address this question of disincentivizing is to, when people start making money, start to ratchet back on the benefit, but not take it away all at once. And so when when the parliamentary budget officer presented, different estimates of the cost, he gave different, ratios. So, for every dollar that somebody starts to make, you could take back by 15% of that dollar or up to 50%. I would suggest up to 50%. That's what the Southern Ontario model used, and makes it a little bit more reasonable for us. But in general, when we look at the costs of it, it was really interesting looking at the parliamentary budget officer's estimate, because we don't at that level right now take into account things like an 8.5% potential decrease in hospitalization. When you think about how much that would save provincial health budgets, like every day hospitalized in a Canadian hospital, depending on where you are and the exact circumstances, but you can think of it as being at least somewhere between $500 and $1,000. Imagine like an 8.5% decrease. So we don't always cost out the health and social benefits of some of these measures. And I think one of the suggestions in our platform actually is that they start to do that at the parliamentary budget officer level. So when policymakers are, trying to consider the pros and cons of a different, step, they can get a better sense, because they won't have recently reviewed the MinCom, literature. We can't expect them to have that in their head. And so that way, if we can, employ some health economists to put numbers to that, I think it will help with decision making.
Cool. Okay. That's there's the idea that they don't think about all these other impacts on health, and that's a similar thought with all the financing that we've seen with climate change and stuff. A lot of banks are now saying it's like, well, the health benefits alone are going to make it worth dealing with,
Yeah, we need to develop systems for pricing out both positive and negative externalities, so that when decision makers are making their calls, they're thinking about the ill health effects of air pollution and how much that will cost, or the positive benefits. So I think that especially if we focus on a well-being based economy, it gives us a really clear goal. And then, as we're decision making, weighing the pros and cons of different things based on whether they get us closer to or farther away from wellness, I think that provides a much clearer framework for decision making compared to what we have now, where we have this sort of foggy, default success measure, GDP, that was never designed for that. And we don't have a good system for pricing out the externalities. So I think that the combination of a clear goal and a system to price out the externalities would really make it much easier for policymakers to try to figure out, okay, well, how much should we spend on this versus that?
Yeah, totally. Fun little tidbit for everybody watching. You might not have seen this article, but somebody did a study that showed that every EV that we buy saves us $10,000 in health effects for the planet, I guess. I'm not sure what the specifics are of that, but feel happy you got an EV if you do. So the next question we got here is on drugs. I'm sure you know a lot about them as a doctor. What is your stance on drug prohibition? Do you support decriminalizing or legalizing drugs in Canada? And what approach would you support and why?
David Murner and I were actually just talking about this about 2 hours ago. Yes, so Bonnie Henry, who's the chief medical health officer in BC, as you know, wrote a great report recommending that we decriminalize possession of drugs, and it makes sense. We know that addiction is a health issue. And we know that when we treat it as a criminal offense, it presents real barriers for people in terms of seeking care. If you arrive at the hospital and, the police are kind of there, and, they're potentially going to charge you for something in the middle of your health encounter, that's a real intersection with the system where we could have built trust, and we could have made you feel welcome, and we could have, given you hope and different avenues to treat your addiction, where you've got a whole other set of things to think about and to deal with that, you're probably not particularly, you probably don't have a ton of energy in your bucket to cope with that, as well as address these. And so we want to make it as easy as possible for people to seek treatment for their addiction. And so, yeah, David and I were talking about it. It makes sense. The police officers, there's an official police officers group in BC that also supports that. And actually, they were saying that, for all intents and purposes, they hadn't been using their resources to pursue offenses related to the possession of drugs in some time, in almost a decade, they said, because they could see that it wasn't very helpful. And there's limited resources within the justice system as well. And so I think that it makes sense to me. We see that things have been working in Portugal. We see that, the overdose related deaths in BC in particular have really gone up a ton in COVID as people are seeking, the drug dealers on the streets are having some of the same supply chain issues as hospitals have been having with regard to PPE. So the supply's gotten more dangerous. And, there's no need for us to be exposing people to those harms. And so I think this is one of these places where, with a thoughtful approach, we can save money on law enforcement. That will end up helping us freeing up money to do the mental health treatment and the addictions related treatment that then becomes much more possible. And so I think, it makes sense. And so, the exact steps with regards to how to do that, there's thoughts that maybe physicians should be doing more prescribing. So all of the prescribing should be coming from the physicians. There's thoughts of, should you just decriminalize the possession and sort of not ask too many questions about supply? I think there's risks and benefits to each. I certainly know that the physician community was very happy to no longer be involved in prescribing cannabis. Particularly there really weren't a lot of studies, so it was difficult for people to figure out, well, what is responsible for me as a doctor in terms of what I could prescribe and feel like I have an evidence base to stand on as I'm doing that. So I think that things will probably move faster if we don't take that approach and we just move to just decriminalizing. But that's a conversation I think that needs to be had with a lot of different stakeholders at the table in terms of, law enforcement and decision makers and public health officers. So I think that, I'd want to hear a lot more people's opinions before I proposed an actual concrete way to go. But I think for sure it's something we should be bringing up because I think that it's a way to prevent a tremendous amount of harm.
Yeah. Well, mental health issue and treating as a health issue. It's if you doing it otherwise, it's interesting you saying that. It's like kicking them when they're down. You're already going through all these issues. Had a lot of success in Portugal. Very cool. So the next question we've got is about Canada's deficit. So in the pandemic, Canada's deficit has been growing quite a bit. And in your view, is this a big problem? Some people think that Canada won't have any choice but to introduce austerity measures and do cuts to programs. Do you think that we can get out of this without putting in cuts to programs? What are your thoughts in general on that?
Well, again, I think we need to start by clarifying what our national goals are, because right now they're really unclear, unexamined, and if you're not using the right metrics, it's difficult to track your progress in a meaningful way. I'm a researcher, and so I've spent a tremendous amount of time going through literature bases. If I'm, one study I did was comparing menstrual cups to tampons. You're like, okay, so which one is better, and how am I going to figure that out? And so you have to spend quite a lot of time figuring out, okay, well, how many people would I need to have in my study in order to prove that menstrual cups are better from a, reduction of UTI, urinary tract infection standpoint? How many people would I have to have if we're just looking at irritation? How many people would I have to have if, we're looking at measures of satisfaction? So metrics are super important. Choosing your outcome is the start of the story. And so we need to change our outcomes because it makes no sense what we're doing right now. New Zealand has a well-being oriented budget where they track natural capital, social capital, human capital, as well as financial and built capital, in addition to GDP, as well as they've defined a list of things that they really care about as a country. So there's things like mental health and longevity and happiness. So we need to have our outcome, because then we're like, okay, what's worth it? And then when you've done that, it makes it easier. When we look at how much we've spent on fossil fuels support since the start of the pandemic alone. We've spent an additional $16 billion. So that's, you know, in comparison to 2 billion extra dollars for clean energy and 625 million for childcare. So I spent a lot of time like, what could you do with $16 billion? Well, that buys you tuition relief, like debt relief, plus free tuition moving forwards, according to the parliamentary budget officer. That buys you pharmacare, like not in addition. Pharmacare is about 12 billion. The other is about 15 billion in the first year and then 12 billion or so moving forward. It's about 10 billion childcare advocates tell me for us to top up enough to have a universal public childcare program. And those probably pay for themselves in terms of their how they free women up to join the workforce and their GDP multiplier effect. And so it's not so much a, you know, do we have enough money problem? It's what are we actually trying to do together as a like Canadian team? And once we define that, then we start to make choices. You know, we're not even taxing our extreme wealthy. That makes zero sense. That's 10 billion we could have right there. We haven't gone after offshore corporations. Like the parliamentary budget officer costed that out. I think it was like, it was a high uncertainty, but it was at least 25 billion. And so, you know, yeah, like we're just not putting our money in alignment with our values. I spent a lot of time on the parliamentary budget officer's website over the last month.
Oh, yeah.
I've gone from being like a nerdy person to talk to at a cocktail party to being a really nerdy person to talk to at a cocktail party. But it's really illuminating. Like it really makes clear, like if we are putting our money where our mouth is, you know, I don't think that we're living our values right now. And so, you know, when you look at, you know, this conversation about debt, so we went into this sort of episode at a really pretty decent debt to GDP ratio. It was, you know, around 30%. When I graduated from high school, it was almost double that in around 1996. So now we've bumped it up. We're about halfway between those two numbers. But still our borrowing costs, because interest rates are so low, are super, super low. So the cost of servicing our debt as a country right now, like if there were ever going to be a time where we could borrow, you know, a fair bit of money and feel okay about it, it's now, because zero humans are talking about raising the interest rate right now. Like the Economist is talking about like, you know, suggesting negative interest rates. Yeah. And so I think what we need to recognize is number one, we need a really clear goal, which I believe is a well-being based economy. We need to choose our metrics really carefully. So, because, you know, imagine being the finance minister right now. You're being asked to solve COVID, climate, and the economic fallout at the same time, and you don't know what your outcome measure is.
It's floundering in the dark,
right? Yeah. You know, you're sort of like, you're tracking GDP, but like, oh, there's jobs, and what about the people? Like, there's no way you could possibly do it.
It's very, very nebulous when you put it that way. Yeah.
And so, you know, we need to sort that out. And then, you know, we need to take a look, okay, well, what's in alignment with well-being? Because I think that's what everybody wants. You know, when I'm in the emergency department these days, people are so stressed out. They're scared, they're vulnerable. They just want a healthy future. They want to know they're going to be okay. They want to know their kids are going to be okay. And that means putting food on the table now. And that means putting food on the table in 20 years, 30 years, because we've kept the climate consistent enough and adapted well enough as a country that we're able to take care of one another then as well. And so that means that right now we need a guaranteed basic income. We know we can't keep throwing money into the fossil fuel industry, because regardless of what we do, existing technological progress is going to mean that our carbon deposits are not going to be the ones that get to be taken out for the most part. You know, we're far away from, you know, people we could sell it to. They're mostly quite high carbon, or a lot of them are. So as people try to hit their Paris goals, they're not going to want to burn our stuff. They're going to want to burn, you know, something that's kind of less carbon intensive. So all of the academic arguments tell us that, like, look, you're probably going to be some of the groups that have the stranded resources first. So we need to take that into account. And that has nothing to do with whether we're going to build a pipeline or not. You know, that's just the way it is. And so we need to be like, okay, well, where's the world going? Okay, so let's take care of one of ourselves. Let's not keep pouring a bunch of money into that industry, because what it's going to buy us right now is probably a lot more tailings ponds and a lot more orphan wells that then is going to be on the public purse for us to have to clean up once the industry finally does completely go kaput. And so, you know, we need to be more defining our outcomes, allocating our resources in alignment with that. And then when you look at the bottom line at the end saying, well, you know what? We'd rather not have a huge, deficit in debt. However, at least we know that right now we're in good stead. Every single high income country in the world is doing this. And we have super low borrowing costs. So that's my general approach, define your outcomes, be sensible, spend in alignment with your values, and then feel kind of lucky that we have a central bank that's denominated in its own currency. So at least we're going to be able to service this debt.
Yeah, yeah. There's a lot of things to look at with the time determining a wellness-based economy. A lot of different metrics you might look at. I suppose we could probably spend this entire time discussing what means wellness in different people's eyes, but it's interesting that everyone always says that it's making the world a better place. Having, not to say anything partisan here, but capitalism is making the world a better place, and they always state that it's improving people's wellness and access to all these different things. Why aren't we just measuring that directly? Instead of having this proxy of money in the middle of it, to see if we're doing well as a country.
Yeah, I mean, in lower and middle income countries, there is a relatively strong correlation between GDP growth and well-being. But in a
Mm-hmm.
high income country like ours, it falls off. And things like inequality start to have a much bigger impact. So we know that inequality leads to decreased trust. It leads to decreased like physical and mental health. It leads to decreased measures of women's empowerment. It leads to decreased children's health. So any measure we take, a wealth tax, guaranteed basic income, that has societal benefit as well as the benefit to the people who are receiving the guaranteed basic income. And so, it's been really interesting over the last couple of months, just going through a ton of literature on this and seeing once you set your sights on like, well, let's just make sure everybody's well now and into the future. It's easy because researchers around the world have spent decades looking into this to tell you what's going to get you closer to that or farther away.
Yeah, totally. There's a lot of evidence out there for it. So we got a question from somebody in the chat here. Shirley says, Dr. Howard, could you please discuss some of the key steps and strategies you see in navigating the country toward a green economy?
So we've mentioned some of them. Setting our goals is really important. In terms of a healthy response to climate change for today's kids, number one, I think we need a Climate Accountability Act. So since 1990, our emissions have been like just going up continuously. Meanwhile, in the UK, they've decreased by more than 40%. And so you take a look at the two countries and you say, okay, well, what's different here? One of the things that's very different is that about 11 years ago, they created something called a Climate Accountability Act. And so they got cross-partisan support and they basically put out a framework act that requires legislators to legislate budgets, carbon budgets, every 5 years. And they have to set them, I think it's about 12 years ahead of time. And so what that does is it creates a really long investment horizon that businesses, individuals, say you were thinking, okay, well, maybe I need, a new car, or a hospital system even is thinking, well, we need to, purchase new ambulances. You have to meet a given carbon budget in a given amount of time. Like the whole healthcare system has its own carbon budget that it's expected to meet.
Wow.
And so there's an incentive to you to purchase, the car that is going to get you to where you need to go. And so as part of tracking that, they also brought forward an expert panel to help them figure out if they were going to meet their targets or not, and actually show the best and most cost effective and best ways for help to get there. I have a small community who has a question. I'm sorry. Yes. My husband's a pediatrician and he's like been on call at the hospital basically continuously for the last couple of days.
Yeah.
Yes, you have a question? She forgot her question.
It'll come back to her. Question from the audience again.
So number one, Climate Accountability Act. Number two, we need a more ambitious target for the Paris Agreement. Our nationally determined contribution, so that's our commitment under Paris. We're supposed to redo it in 2020, and so far we haven't resubmitted one. Right now, ours are not adequate to protect the health of a child born today. And so we need to make those more ambitious. And what I would suggest, and in fact, I wrote a whole article about this for the Lancet Planetary Health, if anybody feels like going to look for it.
I will.
Yeah, it's, it's best, we'll get the most bang for our buck and our effort if we incorporate as many measures as possible that decrease air pollution, make people more active, and support mental health in the meantime. Okay, little sweetie, no. And so, for instance, in Canada, we lose about 1,000 people every year to traffic related air pollution, or to particulate matter related to air pollution. And so that doesn't need to happen. And so if we start by, having incentives for electric vehicles, a build out of electric vehicle infrastructure across the country, which has advantages because we already have, an automobile sector here in Canada. We've made cars, we can make different kinds of cars. We can combine things and make electric tractors to make it easier for farmers to decarbonize as well. And so really, and every time we do that, we spend less money when kids have to go to the hospital for asthma. Parents don't have to miss school because their kids or work because their kids are out of school in the emergency department with asthma. The benefits multiply. And so I would, really, we need the framework to keep us on track. We need better goals, and we need to make sure that within those goals, we're prioritizing measures that improve health and well-being right now, because that saves us money right now, makes us feel better, keeps the skies clear, improves our mental health, and also we get this benefit moving forward.
Yeah. Great set of steps. We got another question from the chat here. Johnny is saying that the Canadian healthcare system mainly covers care provided in hospitals and physicians' office. What is your thinking about the health system? Well, sorry, what is your thinking about what the health system could be and should be? So I suppose expanding outside of physician's office and emergency hospitals.
Sure. And, one of the big reasons why I do this work is because when you're working in a hospital, so many people come and you think to yourself, you know what, like we could have saved you this visit. And seeing me there is about the most expensive way we could possibly care for so many things. And so one of the things we proposed in our platform is a Canada Community Care Act to parallel the Canada Healthcare Act, because essentially, actually, the Canada Health Act was never supposed to be the only one. When they initially brought it forward, there was actually supposed to be a Community Care Act as well, but that one never happened. And so we propose using the same 5 principles of, transparency and portability, et cetera, to regulate the federal, provincial monetary transfers. And we would include universal childcare within that, because we need to look at the care of children and early learning as part of the essential care of children. There's all sorts of stats that show that, particularly for low income children, they do better their whole lives in terms of markers of attention and performance when they get that care when they're little. And so it's one of the best investments we can make in each other, as well as in women and our ability to join the workforce, and incredible economic benefits. Pharmacare we would put in there, because if people can get their, meds outside of the hospital, lots of Canadians don't have adequate coverage, so they can't, even fill the prescriptions that doctors provide. And then, they don't have their meds, and then they get sick, and then they come see me in the emergency department. We would add dental care in there. Some of the most miserable people I see 100% are at about 3 a.m. When they haven't had the money to go to a dentist, and a dental infection got out of control, and they can't sleep because it's so uncomfortable. It's classic. Like in the middle of the night is when dental pain comes in, because people can't sleep. And so then, I'm giving them antibiotics, but they need a dentist. And a lot of lower income Canadians don't have dental care. And so we would propose including that as well. And we also propose psychological care, because, there's a lot of reason to believe that we're going to see an increase in mental health issues as a result of the pandemic. And that's on top of the system that already wasn't coping well with mental health problems. I've worked across Canada, and I've never been in a system that was adequately resourced to care for mental health. So that's, I trained in BC, I worked in Ontario, I trained in Quebec, I worked in Nunavut, I've worked here, I'm on the phone a lot with Alberta. Like, we just don't adequately resource mental health. And so here in the NWT, we do pay for psychology support, but most provinces don't. And so that way we can help keep people, from having to come to the emergency department at 10 o'clock at night with suicidal ideation, by having increased their ability to deal with that in the community, and to, get to stay at home. So that's, one of the main ways that I would address that lack of community care. We're also proposing a national seniors care strategy. The Canadian Medical Association has been asking for that for a long time. And, I was looking at whether or not we should include that in the Community Care Act, but it's very, very, very complex. And they make the point in all of their materials, look, we need to get everybody in a room here to figure out what the best way of doing this is. And having spent about a day reading, I really think that, it needs to be a national multidisciplinary conversation in order for us to do it well. And our elders deserve for us to do it much, much better than we're doing it now. And so I think that so many people, in COVID have really realized that we need to take care of our elders better. And if we do, they can stay at home longer. If we do a good job with home care, they can stay at home in their community in a way that they don't even need to be in, a long-term care facility. So I think those are some of the main things we can do, as well as these, low carbon interventions that just decrease air pollution and keep people out of the hospital for all sorts of good climate related reasons.
Yeah, I really like everything you got to see there. It's an ounce of prevention, right? I can't count how much money I spent at the physiotherapist trying to not get to the point where I need shoulder surgery or knee surgery or whatever. That's great. I never thought about a unified senior care. So we've got another question here. A bit of maybe a more lighthearted one here from, well, maybe not the first part, from Bob in the chat. He's asking, what makes you really mad? And on the flip side, what is something that made you want to jump up and cheer?
The time I can remember, only one time where I have been in danger of losing my cool in a professional situation in the last 5 years. And it was when I witnessed what I can only express as a horrible instance of systemic racial discrimination in the healthcare system. At the intersection of, in fact, it's been twice, at the intersection of the healthcare system and the justice system. We need to we need to first become conscious of implicit bias within the way that we treat people. There was actually just a study that came out a couple of years ago that showed that in the States, newborns who are Black, who are taken care of by a Black doctor, die less than the ones who are taken care of by a white doctor. Yeah, it's horrible. And what's really, oh yeah. And I mean, the thing is that the best presentations I've had on this all stress, nobody goes into healthcare not to help people, but they do come with a system of beliefs that they may not be entirely aware of. And so I think the very first thing we need to do, like I find studies like that when I've been in rooms of other doctors, have really unlocked people's understanding of the fact that, you may be trying to do your best, but this may still be going on in your head, and you might not actually be aware of the cognitive biases that are involved in the decisions you're making. And so I find that those kinds of things remove some of the blame, but leave the urgency of addressing the situation. And so, we've had, I live in a majority Indigenous territory, and certainly, I've seen it makes such a difference to have Indigenous nurses through the system. Almost every shift I work in the Emerge, there's one or two nurses who are Indigenous. The way people are treated is just simply different than when I was working down south. And so, we need to make sure that we're empowering people of all different descriptions to be acceding to, positions of power and authority and professional work. We need to make sure that we're going through cultural sensitivity training. So anyway, that I actually, at about 2 a.m, had to actually close my eyes and just mentally absent myself from a situation for about 30 seconds to avoid
losing it. Yeah,
doing something I really that would not have been considered professional behavior. So that I can't think of another time when I've had to do that.
wow.
Yeah, so that made me super mad. You know what made me jump for joy was actually when I saw two women, and this is with a different political party, but I think we need to, acknowledge when Catherine McKenna and Jamie Philpott were both appointed to Trudeau's cabinet way back when. That was a huge, huge joyful moment for me, to see these, because we're coming from the Harper years, there hadn't been any or so few women who'd been in positions to do good. And Jane Philpott is actually extremely well thought of within Canadian medicine. So I knew her. I knew she'd worked overseas. I knew she cared. I knew that Catherine McKenna was, had also done international work as a lawyer. So to see those two women in those positions, it was huge. I'm the mother of two daughters. And so for me, this is, multi-generational. At that point, I had only just had, I think, I was a new mom, and I was actually becoming conscious of systemic discrimination towards women at the same time as I had just given birth to a couple of them, which is, I think, a bit of a kind of double whammy. And so that really, really meant a lot to me.
It's nice. They got a couple of idols they could look up to. You can point to the great work that they've done.
Yeah. And I mean, they're working their tails off. And, do I agree with every single thing that's happened? Absolutely not. But do I recognize they're doing their best within probably what they can accomplish as one human? I certainly respect the work they've done.
Yeah, absolutely. Cool. Okay. I think we're going to be extending the time just so you're aware and everyone's aware, just because we got a little bit of a late start here. So we're not just 10 minutes left here. But I've got another question for you here. Similar to what you were saying made you furious, at least on the same subject, I believe. In the wake of the death of George Floyd, international protests have called for defunding of the police to address systemic racism and police brutality in general. However, the term defunding the police means different things to different people. Do you support the idea of defunding the police in some capacity? And if so, what would you be calling for as leader of the Green Party of Canada?
When I think about this, I'm thinking about it as a leader of the Green Party of Canada. So when I'm thinking about it, I'm thinking mostly about the Royal Canadian Mounted Police. And I work with them. I work with them every day. They're the people before we had security guards in the emergency department, they were the people we had to call if we had a patient who was, for instance, as happened, throwing otoscopes at the attending physician. We've had multiple healthcare providers go off with PTSD as a result of violent patient incidents. And so to just put that, I am a frontline healthcare provider, and these are people who have prevented me from injury personally. That said, as the example I just gave, there is definitely, there is systemic discrimination within healthcare, there's systemic discrimination within police. And so I think that, one thing we need to do is ensure everything I just said about healthcare happens within the police. I understand that they're already trying to increase the diversity of their recruits, but that a member I spoke with was concerned that some of that energy was getting lost in the training system, and he actually felt that the training needed a complete revamp to make sure that it was reducing the discrimination that actually might have just been inherent within the training. And something I think that we could really do, everybody needs to be put through cultural sensitivity training. We've been going through that. I think most sort of government related groups have been going through that since the Truth and Reconciliation Calls to Action came out. But I found that different ways of presenting this resonate with different people. So, I think it's helpful to just have an ongoing program that rolls out, because you never know when that way of presenting it is someone's light bulb moment, where they're like, oh, implicit bias, because it's not the easiest concept to get across in a way that helps people be open to it and to take additional measures. And one initiative that I really like, and so when I think about defunding the police at that level, I would think about finding resources within the system, within their existing budget, to fund crisis teams. So there are some police cars in Vancouver who always have a psychiatric nurse or an RN with them. And so when there's a crisis call, it's like car, can't remember which car 54 or something, it's got a name.
Okay.
They're the car that goes. And that makes so much sense to me because, you know, especially when we look at some of these crisis calls that went absolutely horribly wrong, you know, how different would that have been if you had a mental health provider with you? And so, you know, in Canada, it would probably be hard to staff that with explicitly psychiatric nurses at this moment in time. One thing our platform calls for is a massive increase in the training of nurses because it looks like we're probably already short and we're going to end up being shorter, you know, into the future. So that's a low carbon caring profession that I think, you know, they're not going to get phased out by artificial intelligence. It's very hard, I understand, for a robot to put on somebody's socks or take them off. I don't know if you've ever tried to take off another person's socks, but it's extremely difficult.
Yes, so my girlfriend had a partial shoulder separation. It's been a trip.
Yeah, it's hard, right? And so I think there's many reasons why investing in care providers will be helpful, and having someone like that in every community in Canada to assist the RCMP to go to these crisis calls, I think, like, I can only see goodness coming out of that. And so when I'm, you know, and you know, we know that that will, just because of who tends to be, you know, impacted in those situations, will, you know, stand to benefit some of the groups that are currently, you know, the most experiencing a lack of trust with police behavior. So those would be how I would frame that. I think the situation is sometimes very different at a city level, but in terms of the national level, that would be my approach.
Okay, cool. So we've got about 15 minutes left here. We're hoping to get a couple more questions in if we can fit them. And the next one we've got is from Shirley in the chat here. She says, do you support the return of children to the classroom in the fall in light of the pandemic?
That is an entirely situationally dependent conversation. There's some very good guidelines that have been put out in terms of everything that needs to be put in place in order for that to be defensible. And I know that, you know, public health units across Canada are looking very, very carefully at that. In some cases, when the public health practitioner's advice hasn't been followed by the politician, you know, I don't think that's a good idea at all. I think we should be, you know, just like we're asking people to do on climate, we should listen to the experts and we should do what they said. So, you know, for instance, up here in the NWT, we've only ever had 6 cases of the coronavirus. We've never had a case of community transmission. We have a super, super tight border. So for instance, if I left the NWT right now, I would have to isolate, mandatory isolation for 14 days upon return, which is one of the reasons why I'm not touring right now. You can imagine up here our limiting factories, and actually ventilators, it's medevac planes. And so there is absolutely no way we could adequately care for a small community full of elders within, you know, just the way our healthcare system is structured. So we have to be extremely careful about prevention. And so, you know, my husband, who's a pediatrician, and I are very happy to send our 2 kids back to school the way they've structured things. We have listened to our chief officer of public health. We have a female premier. They work together really well. Yeah. And I think in that case, it's, you know, good in some of the other parts of Canada where the decision makers haven't followed the advice of public health. I think that, you know, parents are, you know, well advised to really do some personal decision making.
Okay. Yeah. So if they've been wise about COVID, then it's probably okay with the right guidelines. That makes sense. So we've got another question here. Some Indigenous groups in Canada have been on the front lines of resisting fossil fuel development, while others have embraced it and have even partnered with fossil fuel corporations or want to buy into big projects. So what should the Green Party Canada's approach be in regards to respecting Indigenous sovereignty when some nations and groups have decided to invest in LNG, oil sands development or pipelines, et cetera, and some don't? Oh, I don't know if that was...
Sorry, there are small humans here.
Your mic keeps getting muted there.
Yeah, that's me, because there's a 6 and 8-year-old stomping around, getting mad at one another for not doing the dishes.
Oh, well, do the dishes, guys. Come on. Work together. Come on, we got to work together. It's a pandemic.
Oh dear. You're starting to probably get a sense of why I'm such an advocate for universal public childcare.
Yeah, I definitely know there's
been a long pandemic so far.
Yeah, I've heard a lot of stories. There's a lot of women who won't go to work because childcare is so expensive and just doesn't make financial sense even. I get it.
Well, I mean, like to just be trying to do both things at the same time, like there just seems to be no way to do it well.
I couldn't imagine.
Yeah, you know, we do our best. They have read a tremendous number of Archie comics.
So the whole catalog at this point, I bet.
Oh
Hey?
man, like they're using language from Archie comics from 1970s.
Oh wow. Oh wow.
My 8-year-old told me that my shirt was chic the other day. I was like,
chic.
I'm pretty sure I
haven't
didn't
heard that in a while.
And so sorry, we got halfway through the question about
Yeah, no worries. I'll repeat it for you. So the gist of it is that sometimes there's division in Indigenous communities on whether or not they want to support projects, giant corporations, or even get a buy-in to fossil fuel things that are happening, LNG, oil sands development, pipelines. So what should the Green Party's approach be in regards to respecting Indigenous sovereignty when some nations and groups decide that they do want to invest in these things?
So we need to listen extremely carefully. And so, in these situations where, so we know that we need to implement the calls to action of the Truth and Reconciliation. We know we need to align the UN Declaration on the Rights of Indigenous People, our commitment with it. We need to bring that into Canadian law and align. And we need to respect what that demands of us in terms of self-determination. And so I think it's very clear when a process has been gone through, and a group is clearly saying, we're not in favor of this. We need to listen to that. I've done a lot of work around the oil sands. So back when my largest stomping daughter was tiny, we actually lived downstream from the oil sands. And so, when I was nursing her for 8 hours a day, I was looking out at the Great Slave Lake, and I developed this immense curiosity into, well, is there anything in what they say about, there being increased cancer rates downstream from the oil sands? And I'm so nerdy that when I finally was able to book childcare, I actually did a lit review on that. And it was awful because we hadn't done any studies. And we still have barely done any studies. We have simply not funded, like for all of the famous actors and other types of celebrities who've gone to the oil sands. We have not funded a proper study that has, takes traditional knowledge into account, as well as Western scientific knowledge that takes into account the potential for contamination of, local country foodstuffs, of gathering, has all sorts of outcomes, looks at the long term. We have not done the type of study that a country like Canada should be able to, fund and do into the oil sands and the local toxic health impacts. And unfortunately, that situation exists with regards to almost every resource extraction project that you can think of in Canada, whether it's fracking in northern BC, in northern Alberta. We have not done the work. And so, there are really good reasons why our Indigenous communities don't trust the process.
Mm-hmm.
We have not delivered on, Canada's not delivered on the protection the communities need, hasn't even gone looking to see if there are, impacts on health. And so really, we need to listen. And we need to follow the commitments that we've already made, and we've made them, and we need to follow through on them.
So just to be clear, the question was, and I
when
really
there's
appreciate that answer. Yeah, or specifically when there are nations, and even if there's like a series of nations that might even encompass a larger group that say we want to do this because we want the money from it, because they've had so little economic opportunity up until this point, and they're just trying to get a piece of the pie. What should we do with respecting Indigenous sovereignty while still trying to, I don't know, be stewards of the land, even if it isn't ours?
Well, certainly, speaking with and I think it's very difficult when there's a split within a particular community, and that requires a level of legal scholarship and understanding of those systems that I think demands a lot of listening and a lot of study in order to be able to make a decision around that. when, you know, there's different communities along, for instance, a pipeline that, you know, have different, you know, views, you know, we definitely need to make best efforts. You know, it's never going to be a black and white process, but certainly when you speak with, so, you know, there's an indigenous lawyers I've spoken with who care a lot about the climate have said, look, like respecting indigenous sovereignty may mean that, you know, we go ahead with a project that you don't agree with. And I think we need to accept that. I think it's difficult when there's, you know, differences in groups along the line. And so, you know, something that we need to always have in the back of our head is that what, like, how much have we forced them into that position through lack of other opportunity? So when you look at Chief Alan Adams, who has been in the news a lot lately, because he unfortunately was one of the people who was assaulted by the RCMP. You know, I've met him multiple times around the resource extraction sort of discussion in this part of the world, and for the longest time he was so anti oil sands, but he ended up signing on to Tech Mine. And when you look at what he said about that, he said, look, like I've been fighting this for so long. My indigenous community has spent millions of dollars in legal fees, and we haven't had any other opportunities given our way, like thrown our way. So how much are we, through systemic discrimination in the rest of our entire approach to our indigenous communities, painting them into a corner where they have no other option in terms of economic development than to say yes to one of these projects? And that's their best assessment, even though they love the land and they love the water and they understand much better about climate change than most of us, you know. So really, I think it's sometimes we talk about this as entirely a resource dependent issue, but it requires reevaluation of all of it. So we need to deliver on all of the calls to action of the Truth and Reconciliation Commission, I think, in order to be able to address this properly.
Okay. Yeah, nation of nations. There's a lot of different nations in Canada that we need to respect. We got so we got a lightning round coming here because we're right at the close and we want to fire through just a couple more here. So the first question is from Ilan in the chat, who you met earlier. You and your husband both have medical practices in the Northwest Territories. Do you see yourself being able to run a national political party from there, or would you have to move closer to the 49th parallel?
I think that so much of this is going to depend on COVID. So I'm lucky as an emerge doc. I basically show up for work really hard, and then leave. So I don't have the same, you know, requirements in terms of running a business and a practice as people in other parts of medicine would. I would love to be able to still work at least a couple of shifts a month on average, because I find that it grounds me and makes me aware of what people are actually caring about. It drives a lot of my work, and I think it's better for the party if that bond is maintained. My husband has actually resigned as medical director and signed a new contract that moves him down to 50%. So that's the plan, regardless of whether or not I win. But you know, that gives us the opportunity to, in the next year, have a lot more flexibility. And he actually trained at CHEO in Ottawa, and so we have connections in Ottawa and in that community. We understand that it may make more sense for our family to end up moving, at least for a large part of the year moving forward.
Okay, next question. The Green Party has a policy to reduce the voting age to 16. Some people are worried that teenagers are too irresponsible and unrealistic to have that responsibility. What are your thoughts on the issue?
We've endorsed that again as part of our platform, and in fact are going to do our best to sign up as many people between the ages of 14 and 16 to the Green Party in the next couple of weeks, because you know, I see young people as some of the most driven in medicine. They say we're too young to know what's impossible, so we do it anyway. And pretty much everything good in climate change and health has been built by a medical student. So whether it's the Lancet Countdown on Climate Change and Health, the Global Climate and Health Alliance, the EAT Forum, you know, they're just driving the agenda. I've learned incredible amounts from young people. So we want them to be involved because they have important things to say. They haven't got those eyes of cynicism, I think, that those of us who are older do. Number two, from an intergenerational justice issue, the decisions we make now in this particular time window are going to disproportionately impact them. So I believe that they should be empowered to participate in those decisions. And number three, you know, other countries have done it and it's worked out fine. Number four, in other parts of life, whether we look at the ability to drive a car or some of the decisions that we entrust to teenagers in the medical system, they're the ones who get to decide if they get a bone marrow transplant, if they're in their
Yeah.
teens and they get bad cancer, right? So we entrust them with a high degree of responsibility in other parts of the world, and I believe that they deserve that same trust from us when it comes to the political process.
Okay. That definitely affects them a lot politically. And the last question here, absolute last one of the whole thing. Beyond winning more seats, what is the most effective way for the Green Party of Canada to affect the national conversation on critical issues facing Canada?
Well, especially at this time of combined climate crisis, economic crisis, and coronavirus crisis, framing our work in terms of health and well-being will give us the clearest narrative. It will speak to Canadians, meet them where they're at. And there's a ton of evidence to show that, particularly on climate, that is the best way to motivate people to take action across the political spectrum. So I believe that the Green Party really will be most effective if it goes from being the party of climate change to the party of planetary health.
Very cool. Okay, so we're at time here. Do you have anything else that you would like to say to the constituents, voters of Nanaimo, Ladysmith, and everyone who's watching? Any final last words?
Just to say a big hello. I'm from BC. I grew up in North Vancouver. I lived in Vancouver for most of my life, and then did my family practice training on Vancouver Island in Victoria. And I've spent some time at Nanaimo Hospital. So, thanks for participating. I'm thinking about you guys. I miss the big trees. This is actually the longest I've ever been without being down to visit my dad in Vancouver. So thank you for the work you're doing for the Green Party. Thank you for holding down the fort in that absolutely gorgeous part of the world. And I look forward to working with you as a leader of the Green Party.
Well, thanks for coming on. What's your website, if you could tell it to us right now?
Sure. We're at drcourtneyhoward.ca. And our platform is up. I made it nerdy. Will Gagnon, my campaign manager, made it beautiful. I think it's pretty well done. I've been getting really good reviews on it from some people whose opinions I hold very high. So I'm proud of it. And we have a really incredible set of webinars coming up on Thursday. So my ultimate hero, James Orbinski, and Elizabeth May will be joining us next week. This week we have Glenn Murray and some people speaking about turning eco-anxiety into action. And then a couple of weeks from now, we have Kat Abreu, Diane Sachs, and award-winning climate communicator Ed Maybach joining us for just a climate workshop with honestly some of the best minds in the world. So come join us. It's going to be really, really incredible in terms of discussions and planning.
Very exciting. Just got one last question personally. I've got this really weird thing on the back of my head. Do you think you can take a look at it? You're a doctor, right?
Probably it's a mosquito bite. If you were in Yellowknife right now, that's a mosquito bite. So, I mean, I can diagnose it from here. I'll just pretend you're not.
I'm kidding. There's nothing there. Well, thanks so much for coming on. And yeah, have a great night, everybody. Thanks for joining us, everyone. This video, by the way, it'll be shared on, we'll be sending it out in an email update, just like all the other ones as we have. And we've got more leadership interviews coming up pretty much every Tuesday for the next month or so here. So everyone keep posted, and thanks for coming on.
Awesome. Thanks so much. Really nice to chat with you. It was a great discussion, great energy.
Awesome. Thanks.
Perfect. Okay. Take care, everybody.